My name is Benzi. I'm a paramedic. I'm the head of the nursing staff in this clinic. I've been working here for already a year and a half since this clinic was open. And today I'm working mainly and mostly at the emergency department of the clinic. Ministry of Health and Terem decided to open this clinic together. Before there was a clinic in the upper floor in the central bus station, and they decided to make an emergency room. So they asked me to help building the emergency in this clinic, and that's why I'm here. What's happening is during the opening of the emergency, we see, you can say, between 50 and sometimes 100 patients for 12 hours in the emergency that come from different causes like fever, like vomiting, diarrhea, lacerations, skin problems, coughing, and several more reasons. And we see them, we examine them, we take their vitals, we take blood if it's necessary, a doctor check them, and then we decide what to do next. The main difficulty over here is, first of all, the language, and also the culture, which is totally different from what we are used to. From Israelis or even Americans or even other countries. Because of the language problem, we have translators working with us almost all time. And because of the culture, we need just to adjust to it, to know how to work, to understand what bothers them, what are the real reasons that they come, why are they worried, what do they think about medications, what do they think about medical treatment, about doctors and blood taking, and even about diseases. Sometimes people come here because they need support, mental support, more than physical support. Sometimes they come because they're unoccupied and they found this place like a sort of a way to meet friends, to meet other people, to see what's going on in the world, and sometimes also to treat their health. Why? So first of all, this is the work, and I'm working here because this is my job. Second of all, because as I said, it's a very important place, a very important help these people need, and with no relation to the political reasons or other reasons. If they're here and if they're sick and if they need it, then somebody needs to treat them. There aren't special events like I don't know. It's the thing about this population is most of them are quite young, between the ages of 20 and 30, and lots of babies, lots of pregnant women. So when you see most of them, they come from very small, very little and minor. I don't know. Lots of small health problems. Most of them are quite healthy. Most of them come just for very small problems, and that's why this population is quite healthy and doesn't need more exams and more tests and more work than other older and sicker population, especially over here. As I said, I think this clinic is very important and very rare because it treated those people that don't have insurance. Those people that if they won't come here, they will go maybe to hospital and maybe stay at home and get sicker and sicker. And that's why this place is so important, to stop them from getting to hospitals and getting more diseases over there, and stop them from getting to hospital about small problems and making the hospital busier and busier, and to stop their diseases at a early level, early state of the disease, so you can treat them now and not when they're more sick. I think, first of all, I think that the staff over here are doing great work. I think that Orel, the head of the clinic, is making amazing work. He's working very hard, getting more and more ideas just to see how can he help. And I think that the work that people do over here is really what we call in Hebrew avodat kodesh, like that important that it's like holy. And that's it.